Welcome, everyone, and thank you for joining part one of the Iowa Cancer Consortium's Cancer and the Environment 101 webinar series. For folks who may not be familiar with the Iowa Cancer Consortium, we are the state's comprehensive cancer coalition, composed of over 650 members working across the state to advance cancer prevention and control through advocacy, equity, and collaboration. My name is Caroline Powell. I use she, her pronouns, and I am the staff lead for our new Cancer and the Environment Task Force that started over the summer. And we've aimed to better understand and communicate the potential impact that agricultural, occupational, and environmental exposures may have on the state's increasing cancer rates. So now I have the pleasure of introducing Molly Jacobs, who is the Director of Applied Research for the Sustainable Chemistry Catalyst, a research institute at the Lowell Center for Sustainable Production at the University of Massachusetts Lowell. Molly has over 20 years of experience in public health research and practice, which has culminated in a deep expertise on the environmental and occupational causes of cancer. We are so grateful Molly's taking the time to chat with us today, and really excited to learn more. So I will pass the mic over to Molly.
Thank you for having me. I'm Molly Jacobs. Yes, I'm our Director of Applied Research in a research group out of the University of Massachusetts Lowell. And I had my roots. I'm trained as an environmental epidemiologist, and in the first years of my career, I worked for the Massachusetts State Health Department, where I helped to field kind of questions and ran studies around our state where we were concerned about disease clusters as they might relate to an environmental exposures. And I found myself kind of moving upstream. And now I work more on the prevention side of it. So I studied the problem, and now I'm working more on the solutions. I work directly with businesses. I work directly with government programs to try to advance alternatives to toxic chemicals and to try to advance kind of prevention paradigms that we get to see here through the Cancer Consortium to reduce, risk as it relates to environmental and occupational cancers. So, I guess I want to just start out with the message that we all probably hold dear to our hearts, everybody on this webinar, which is prevention works. And we know that, especially from the incredible story around lung cancer prevention and also many other cancers that have been prevented due to exposure to tobacco cessation. It just means that when we put our energy into stopping an exposure that we know causes harm, we see results. And we absolutely have seen that in lung cancer. We see that again, these charts show kind of all cancers combined, as well as kind of a set of around 11 or so cancers that we know to be related to smoking and lung cancer. And we see this in Iowa. We know that rates have definitely decreased in lung cancer in men, and they're starting to level out in women. But my next message is, I guess, a little bit more sobering, which is progress is just not equally shared. When we've kind of focused in on certain risk factors as they relate to specific types of cancers, we're seeing results. But for a number of cancers, we're seeing increases. And that's true for, a selection of the types of cancers that I show here. These charts I grabbed from the National Cancer Institute, what's called the Surveillance Epidemiologic and End Results Program, the SEER program, which is a collection of cancer registries throughout the United States. Well, we have data thanks to a registry like Iowa's that was established in the mid-1970s, all the way back to 1975. And you can see from a long-term trend, right? We have a problem with a lot of cancers that are going on the rise. Some are starting to decrease in more recent years, but they're nowhere near where they were decades ago. And we also know from the most latest cancer report out of the state of Iowa, and we're going to hear more about this, I think, next week with Dr. Mary Charlton, that some cancers are on the rise in Iowa, and the question everybody's asking is why. one thing that I think is particularly striking, and I know it's an issue that goes to the heart of many of us, is that childhood cancers in particular are on the rise. They've risen over 40% since the mid-1970s nationally. And I hear that that's, we're also seeing kind of increases in childhood cancer in Iowa as well. And what's poignant about this trend is we can't lend the same risk factors, if you will, that we know to be associated with adult cancers with children. We can't blame it on a poor diet. A 1-year-old cancer cannot be explained by poor diet, smoking, lack of exercise, right? So something else is going on. And we know that the genetic components of this disease can only explain a small fraction of it. So in our cancer prevention work and our risk reduction work, we focus on many important risk factors, tobacco obviously being one of them, alcohol being another, poor diet, infections. These are all known causes of cancer. They all deserve attention to do whatever we can to reduce these risks. But if you notice, there is something missing here. Most cancer programs do not have an environmental occupational component to the work that they do. They do, for example, with environment, it's primarily focused on radon. And I'm applauding Iowa for taking on this task of thinking much broader and bigger and changing this paradigm, which I think is in part because it's, a lot of these programs are housed within kind of public health programs. Environment is somebody else's problem. Environment goes to that environmental agency, not the public health agency. And so many times I think these risk factors have been overlooked. And this is such an important program to pay attention to it because people care and things happen when people care. And I'm not the only one who thinks that this is an important and overlooked risk, factor that has been under-addressed in cancer programs writ large. In 2010, our U.S. President's Cancer Panel issued its report. They tackle a problem facing cancer programs nationally every year, whether it be sometimes disparities, whether it be infectious agents. And in the 2008 of over 2009 time period, they took on the content of environmental cancer. And we were told by the panel, they actually wanted to steer away from it. They just thought there wasn't much truth or scientific evidence that grounded the concern. They thought it was just a lot of environmentalists and advocates that were like raising alarm where there was no alarm to be raised. And their minds were blown when they heard from dozens and dozens of researchers over testimony in 4 different meetings that lifted up the state of the evidence with regard to environmental occupational cancers. And as a result, one of the main kind of messages in the report is that the true burden of environmental cancers has been grossly underestimated. And they go out to kind of put forward a number of different recommendations going forward for all of us to attend to. So I recommend kind of this report for the consortium and for the task force to look into more deeply. So one of my roles today is just to talk about what do we know about environmental carcinogenesis. And this is about the ability of kind of agents in our environment to cause cancer. That's what carcinogenesis means, the ability to cause cancer. And so I'm going to hold on for just a second because I really want to try to get rid of this poll. Okay, I did it. It's weird to give a presentation when there's this major thing in the middle of your view blocking it. So one of my main messages today about cancer is it's highly complex. There's not one agent that causes the disease in an individual. It's a complex, multiple stage process that unfolds over time. And there's a group of researchers and some out of an agency that I'll speak more about, the International Agency for Research on Cancer, that came out with basically 10 different key characteristics of a carcinogen, what that carcinogen kind of does to us that makes cancer more likely than not to happen. And these are very biological terms on the left-hand side. Some of it is, does it mutate our DNA? Is it genotoxic is what we call it? Does it induce chronic inflammation? These are kind of signatures, if you will, of how agents act to go down this mechanistic pathway of causing cancer in our bodies. The key is that there's multiple steps that have to happen. And I want to show this pie on the right-hand side because I often use this. This is a metaphor that's used in epidemiology about disease causation, and it's called the component cause or sufficient cause model. And basically what it's saying is your whole pie needs to be full in order for the disease to happen. Every kind of slice represents a component of what has to unfold in order for cancer to develop. What it also means is all of us are exposed to things in our environment, to things that we eat, that we know increases our risk for cancer, right? Those are kind of one pieces of that pie being filled. We still, through resilience and a number of other opportunities, if we can just keep one slice unfull, the disease won't happen. So the message is here is one of, we need to do everything that we can. We don't know how this is going to unfold in people, but we have to act on what we know, and understand that, cancer itself, not one agent is going to cause the disease. We all know of smokers who never got lung cancer, right? There are other things that had to happen in that those individuals in order for the disease to develop. But I want to argue that, attending to the environmental causes of cancer is just one more thing that we can do in order to keep that one slice unfull. So some of the lessons of what we know about environmental and occupational cancers come from history. Some of the earliest examples were in the 1970s, in the 1700s, we observed scrotal cancers among young boys who literally were ushered down into chimneys in order to clean the chimneys. And we later learned that what was causing cancer, the cancer itself, was one of being exposed to a compound in that soot called polyaromatic hydrocarbons, or PAHs. I don't know if you all have ever seen or read the stories of the radium dial workers, but these were women in the early 1900s that used to paint the dials on watches or on aviation instruments to allow them to irradiate at night. And what they were painting it with is radium, which we know is highly toxic, is highly carcinogenic. But they used to actually, lick the tip of their paintbrush with the radium paint. And what resulted were a number of different cancers being seen in these young women: bone cancers, nasal cancers, leukemia, soft tissue sarcomas. Other examples, we know that the solvent benzene is linked to leukemia. We knew that back in the 1920s. We still use it. We know that asbestos is linked to lung cancer and another type of cancer called mesothelioma. Hasn't been banned yet in the United States, as well as a number of other cancers that we've known through history. One of the main lessons here is that a lot of what we know about what causes cancer in our general environment is based on studies in workers. They're most exposed. Those are studies that are much more easily controlled and conducted than something that's more in our general environment. But we know a lot. And we know that I'm going to show you, kind of some examples of chemicals or agents in our general environment that we know can cause human cancers. And this isn't just based on my literature review, although there's more to be said than what I'm showing on these slides. This is based on kind of what we call authoritative reviews. The International Agency for Research on Cancer, which is a research institute of the World Health Organization, convenes bodies of scientific experts to review the state of the science on the connection between an agent and its ability to cause cancer. It's not just environmental, occupational. They've looked at HPV. They've looked at a number of different agents that as to whether or not it can cause human cancers. And based on their review, we know that there are 121 known agents that can cause cancer in humans. 89 that we probably can cause it, and this is kind of based on some epidemiologic evidence, as well as sufficient evidence based on animal studies or toxicology. Possibly is primarily based on clear evidence from animals, but we lack evidence in humans. So in total, only about 1,000 chemicals have been reviewed. This number is kind of important to me because I know how many chemicals are circulating in our economy today. There are over 3,000 what we call high production volume chemicals that are used in commerce, that are used to make the materials and goods that we all use. And every year, about 150,000 new chemicals are added. So what this means is we've only studied a sheer fraction of that which is circulating, in our commerce. But even still, we know a lot. 40% of those carcinogens are actually what we would call industrial carcinogens. These are exposures that are happening to workers. And what that also means is that when you use it to manufacture a product, sometimes it's in that product, right? It's going to cause potential exposure to consumers. It also means that it's likely being released as emissions, either to the air or to water. And so a lot of the environmental pollutants that we experience are based on their use in industry, right? So these industrial exposures ultimately matter in terms of the environmental exposures. Well, how we know what we know, this is a crash course, if you will, or the slide in kind of study designs. But the main tool that we use to make that connection between cancer and humans are epidemiologic studies. These are studies of disease in humans based on, looking at differences in exposure between, for example, cases and controls. Do we see more disease in the cases or the controls, right? Or in a cohort study that we study for a long period of times where we enroll a number of people and understand what exposure experiences they have, and then see who develops the disease and who doesn't. These are observational studies. And I say that because epidemiology, as opposed to toxicology, where we study kind of disease in animals, that's experimental. We control everything there. We can dose the animals, and I'm sorry for those that are sensitive to that topic. But the point being, we can't dose individuals. We have to observe it. And so there's always a lot of limitations in the studies. There's always questions of confounding factors, other things that might explain the result, right? Rather than the one that you're directly studying. And so there's always uncertainty, if you will, in epidemiologic studies. And that's why you see a lot of people kind of toss it. Well, does it cause it? Does it not cause it? Does it not cause it? And it's inherent in kind of using an observational tool, if you will, for studying this problem. We also know a lot just by doing exposure assessment studies. So in the case of a lot of things that we've already made the connection of a disease exposure response relationship. Now we want to study, well, who's all exposed to this and at what level? We're kind of not looking at the disease endpoint, but we're trying to look at who's being exposed and to how much, or if in fact we can reduce exposure, through certain interventions. The last two are more just other examples of how we know what we know. Again, when I mentioned the International Agency for Research on Cancer, the probably and possible are highly dependent on evidence, known evidence and toxicological experiments. And these can include in vivo, which means like the whole animal study, or even in vitro studies where we're actually just looking at kind of cellular effects and understanding how cells work and are modified based on exposure. So know that these are the range of studies that contribute to the knowledge and understanding of whether or not an agent can cause cancer or not. One additional thing that I just wanted to mention is that over time, especially with regard to environmental epidemiology and environmental influences on cancer and occupational influences on cancer, is that there's that saying that dose makes the poison. Well, in some ways, it doesn't always make the poison. And what else matters? One thing that I is really important when it comes to environmental causes of disease is that the timing of exposure matters. A really illustrative example of this comes from a study that was conducted out in California by Barbara Cohn and colleagues, where they actually were able to bank bloods. So these were women who had taken their blood at Kaiser Permanente back in the 1960s when they were adolescents, when they were 12, 15, 18 years old. And they were able to track these women over time with the question of who developed breast cancer and who did not. And they measured those bloods with regard to DDT. DDT was a pesticide that we used, throughout the 50s and 60s to kill mosquitoes, for example, that caused a lot of the raptor population decline. Our bald eagle and declined as a result of our use of these chlorinated pesticides. But what they saw was that women who were exposed during developmentally sensitive periods of time, so when their breasts were developing during puberty, had over a 4-fold increased risk of breast cancer later in life. And we see some of these same patterns, especially when children are exposed in utero. We see sometimes that the highest risk of things like leukemia in children are based on whether their fathers were exposed prior to conception or their mothers were exposed while the child was in utero. These sensitive developmental periods of time are instrumental in terms of causing diseases like cancer later on. So it's not just the dose, it's also when you're exposed that matters. We know things like size and shape of an agent matters. For example, one of the main air pollutants that we monitor over time that's regulated under EPA is something called fine particulate matter. These are particles under 2.5 microns in size. And we know from reviews of the International Agency for Research on Cancer, this particle has been studied for decades, and there's clear evidence that it can cause lung cancer. And in part, it's a delivery device. There's all sorts of chemicals that can adsorb onto it and get delivered deep into the lung to cause scarring, to cause all this, perhaps some of those characteristics of carcinogens that you saw on that one slide. So size matters. And this is also important. We're learning also with regard to this burgeoning nanotechnology field where we're seeing some engineered nanoparticles. Also, size matters. It's that delivery device, but also shape. There's one kind of engineered nano material called carbon nanotubes. And they look and act, some of them at least, like asbestos. They're long and sharp. They look like needles. And there's evidence that they do the same thing that asbestos does in terms of kind of puncturing the lung and causing inflammation that ultimately results in kind of the carcinogenic tumor development. We also know that it's not just high doses that matter. Sometimes we like to see that dose response curve that tells us that something is going on. Low doses matter. There's a whole field called endocrine disrupting chemicals. And these are chemicals that act just the way our hormones do in our body. Things click on and off in our body with really, really, really low doses. And we're seeing that chemicals can act at those very low doses to do the same thing and disrupt our endocrine systems that also then lead to things like cancer development. And there's a number of different endocrine disrupting chemicals that act at these incredibly low doses. The class of chemicals called PFAS, per and polyfluorinated alkyl substances. It's a big word, but what this is it's that chemical that makes your Teflon pan non-stick. It's what makes your Gore-Tex jacket water repellent and resistant. They're very good at providing oil repellency, water repellency, stain repellency. It's what makes any kind of fabric in your home on your couch stain resistant, right? Those are PFAS chemicals. bisphenol A, flame retardants, phthalates. These are all chemical names, but they're found in so many different products that we all use, and can enact these effects at very low doses. And the other thing is that we study chemicals at one at a time, right? We want to control for everything else and understand what that one chemical does. But the reality is, look where we live, right? Look how we live. We're not exposed to single agents. We're exposed to mixtures, and mixtures matter, and mixtures complicate kind of the scientific inquiry. But it's something that we're trying to have to reconcile as we, try to move forward and figure out what we can work on and how and what it all means. So some examples of known human carcinogens, we can look at these by kind of like the types of chemicals, and, don't shy away. I know chemical words are kind of a heavy lift for many of us. And, when you look at the back of a shampoo bottle, you're like, I don't know what that is, and I can't even pronounce it. So I'm moving on. But that's kind of what's happening here. But do know that all these chemicals, they provide a function in the application and goods that we all use. But many of them that cause cancer, for example, are heavy metals like arsenic, which is an important one to know because we can often see it in our drinking water. Beryllium, cadmium, radioactive substances like radium or radon, industrial chemicals. Trichloroethylene is a really important solvent that's used in a lot of like degreasing agents. Other chemicals like perchloroethylene, which is the solvent that's used in dry cleaning, as well as combustion products. So these are all the things that, what comes out of your car exhaust, or what gets emitted, out of smokestacks, right? These are all combustion products, and there's a lot of things in there. And what's listed is just some of them. So I'm just going to go through a few slides and look at these kind of by where they are in our environment. So here's a laundry list of known human carcinogens that we can find in air pollution. So air pollution is a mixture of hundreds of different agents, over 100 different agents. And it all depends like what was being combusted or what's being emitted, how volatile it is, and so we can see all of these different agents sometimes in air pollution, and we know they cause cancer. The mixture of air pollution is a carcinogen, according to the International Agency of Research on Cancer. But individual constituents in that mixture are also just known contributors of it. So these, again, lots of different chemical names and words. But the point is, we know a lot about air pollution and the causes of cancer. These are known causes of cancer from air pollution, pollutants. Similar list for drinking water. What's important with drinking water is we kind of have two systems that regulate or don't regulate chemicals in drinking water. We have our public water authority. So if you get your water from, a municipal authority, it's treated and it's tested. If you're on well water, it's up to you to treat and to test, or to test and to treat, depending on what's in it. And so we know, for example, that arsenic or radium can be a very significant problem in those that are using water sourced from private wells, which is the case, which I'm on a private well. So I have to get my well water tested. It was high in some contaminants, and I do have to filter it. So that's up to the individual, unfortunately, to do that. But we have known treatment devices for the majority of contaminants that are out there. There are sometimes other problems with public water authority water, where the process that we use to disinfect water actually can create more problems because of the organic matter that's in it. So something called disinfection byproducts. A number of public water authorities have high levels of disinfection byproducts, many of which have been linked to cancers. So it's kind of a mixed bag depending on where you are. But in many cases, there are treatment options for all of these. Nitrates is another important source of water contaminants, especially in agricultural communities. Again, though, we have treatment options for those, but you have to test in order to know it's a problem. Other types of consumer products that we know sometimes can have carcinogens in them. Hair dyes for the longest time have compounds that are called aromatic amine dyes. It's the dye, but the aromatic amine is simply the compound that that makes it the dye. Darker dyes were known to kind of have higher risks. We do know that many hair dyes have been reformulated over the years. So one of the issues that we have with sometimes with our research, cancer is a long latency disease, right? So many cancers like bladder cancer that is associated with aromatic amine exposures, an exposure to disease kind of time period might be up to 30, 40 years, right? So these researchers are studying things that happened that people were exposed to 30 or 40 years ago. We do know that product formulations change, and that is the case of hair products. But some hair products still have problematic agents in them, like formaldehyde. So a lot of keratin treatments that make your hair straight or straightening products can have formaldehyde or formaldehyde releasing agents. And this is a known carcinogen. There's a lot of movement in some states to ban that chemical, in particular in hair straightening products, because of the evidence related to cancer. Again, other compounds that are on that list are found in various personal care products or construction products or home products. And the last one here is just, pesticides. I know this is an issue for Iowa. All of these chemicals that are on this list have been reviewed by the International Agency for Research on Cancer and either are known or suspected carcinogens. And these are all still being used in the United States. There's a much bigger list that is being researched. There's a number of studies that are actually being conducted in Iowa that are looking at a range of different pesticides and their impacts on health, including cancer. So there's a much deeper literature here to look into than what is here and what's been reviewed by scientific bodies like IARC. So note that this is just a drop in the bucket, probably compared to those that we might want to take a deeper look at, where there is evidence for concern. The last thing that I want to talk about is just with regard to what we know as childhood cancers. I was part of a report that was issued a couple years ago through the Childhood Cancer Prevention Initiative, where we looked at the state of the evidence with regard to environmental exposures and childhood cancers. And I have to say, there is a robust volume of evidence linking pesticide exposure to childhood cancers, exposure to near traffic air pollution, as well as exposure to paints and solvents. And, for pesticides, for all of these cancers, what we know are associations with the most frequent childhood cancers, like leukemia, which is the predominant cancer that is experienced in children under the age of 20, but also some brain cancers. So most of this evidence is, we haven't looked into the broad range of childhood cancers that are out there. It's just a lot easier to research the ones that are most frequently occurring. And so for pesticides, both insecticides and herbicides have been implicated. And risk is, highest based on exposure in utero. So, and also, this is especially true for parents that, whose occupations are dependent on using pesticides, whether they're pesticide applicators, whether they're landscapers. Again, the parental exposure is just as, if not more, important with regard to childhood cancers. Near traffic air pollution, it's actually exposures that are happening earlier in life that we see. So when the child is kind of in its first months of development, that we see the highest levels of risk. And so most of these studies that have been conducted are based on kind of proximity to high traffic volume roadways. But some studies have dug into agents of particular concern that might be in the emissions from traffic, and we do see associations with chemicals like benzene, which we know is a cause of adult leukemia, as well as other compounds like 1,3-butadiene. Paints and solvents is another class that we see, and a lot of this is based on, again, parental exposure while the child is in utero. So we see, painters or we see use of solvents in your occupation can actually increase, risks of childhood cancers. And again, this one is particularly for leukemia. The last thing that I just want to mention is the term environmental justice. And a lot of the work of the Cancer Consortium is deeply concerned about health disparities. Well, when we think about environmental cancer, we see exposure disparities. We see that for many low-income, non-white, indigenous, and refugee immigrant populations, we see them often bearing the disproportionate burden to hazardous chemicals, many of which are carcinogenic in nature. And so the US EPA has an environmental justice definition, which you can read here, but it's all about kind of reducing these disparities. So health disparities like cancer are associated with exposure disparities at first. We see an overburdened experience of exposure to toxic chemicals from kind of our systems of production, our systems of zoning, where people were allowed to live versus not were allowed to live, and being frontline workers. We see, landscapers, janitors, line workers are often experiencing kind of an overburden blow in terms of exposure than many others. So this is kind of an important concept in the world of environmental health and absolutely applicable to a lot of the concerns around cancer disparities. Exposure disparities will result in cancer disparities. So for the next 10 minutes, I just want to kind of go through, well, what can we do about it? So again, what I love about being able to talk to you all about this topic is I'm kind of talking about my career here. I'm talking about like working very deeply and trying to understand what we know about the problem, but it's not enough to just understand the problem. We have to do something about it. So what can we do with regard to preventing cancer associated with these environmental and occupational exposures? Again, I just want to pull up that kind of chart and that pie chart around cancer is complex, right? So we know another way to kind of describe this is also with the metaphor of a light. There's a lot of things that have to be in place in order for that light switch to go on. You have to have a power supply. You have to have, you have to have a voltage that's moving through it. You have to have a switch in order to turn it on. All of those things have to be in place and for the light to go on. Again, same metaphor works for all these different pieces of the puzzle for for the carcinogenic mechanism to unfold in our bodies. But it opens up the door for prevention. And again, going back to that chart with regard to lung cancer and exposure to tobacco smoke, we removed that tobacco smoke, we saw lung cancers go down, even if there were other things that might also need to be in place in order for that cancer to develop. What's interesting about tobacco smoke is that it hits many of those characteristics of carcinogen all in one foul swoop. But again, other things still had to be in place, especially for some individuals, again, who we know never got the disease. It's also true, this kind of metaphor about turning off the tap, turning off the exposure is also true when we come to the environment. And we saw this in a cancer cluster in Massachusetts in the town called Woburn. If you all ever saw the movie, I don't know, a couple decades ago called The Civil Action or read the book, it's a story of contaminated water from industry that impacted a number of different neighborhood blocks in Woburn. And we saw spikes of childhood leukemia. We didn't know what it was, but we turned off the tap. And when we turned off the tap to the contaminated wells, we saw childhood leukemia rates go back to like baseline, if not to zero. So turn off the exposure. If we turn off the exposure, we can prevent the disease. And one thing I just want to say, and we do this a lot in trying to figure out what priorities to work on when it comes to cancer risk factors. But there's a lot of question about, well, how much cancer is really caused by chemicals in the environment? That is an unknowable question or answer to that question. I won't go into this whole methodology of trying to ascribe percentages of how much disease is caused by a given agent, or how many cancer deaths are caused by a single agent. What's messed up with that methodology is exactly that whole thing of not honoring the complexity of cancer. It assumes single agents can cause that disease, right? It's an unknowable answer. I just feel like we're asking the wrong question. Why don't we ask the question, if cancer rates are rising and there are chemicals that we know can cause the disease, why don't we find ways to stop using them, right? That is a more productive question to answer. And I think there's ways that we can go about answering that quite well. This is just a schematic that we developed based on others out there that just kind of talk about these intervention strategies. These when we talk about interventions, these are the programs like a quit line for tobacco cessation, or a patch that you can use to stop smoking. Those are called interventions to help mediate the exposure, to hopefully reduce the risk of the disease. And our interventions, range from education, motivating people to do something, to redesigning a system or a product, to substituting with a safer alternative, or eliminating the exposure altogether, because for some reason we find out we didn't need to use something in the first place, right? These are all kind of intervention strategies, and they can happen at an individual level, especially things around education. They can happen at an institutional level, like supporting businesses to figure out safer alternatives to use versus the toxic ones for a given application or a product. Or they can happen at the policy level, right? And I'm going to give you some examples of all of these. And again, these are food for thought for the task force about strategies that are out there that can intervene on this problem and help to reduce risk of exposure, that is. So one is kind of educating our healthcare community about taking environmental health histories. I don't want to, maybe we have some of our physicians on the line with us, but I'd be curious to know how many hours of environmental health education that you had in medical school. The rumor is only a couple hours for the majority, right? There's not a well-steeped knowledge base within our medical community to identify these risks, to help support patient education about what to do. So there are tools that are out there to help identify potential sources of concern and to educate patients about them. Another is using apps that we have on our phone that can help give us tips about products to avoid, about strategies to use to reduce our exposure to toxics. And so one has been put out by an organization that is well respected, called the Silent Spring Institute, called the Detox Me app. And they actually paired the use of this app with actually doing biomonitoring studies and looking at people's body burning of exposures prior to using these apps and after using these apps. And they saw drastic reduction in exposures via monitoring kind of toxic chemicals in our blood or in our urine based on using these apps. And their tips that they advise, like, don't paint the nursery if you're pregnant, right? Don't use glass containers rather than plastic containers. Don't heat up your food in a plastic container in a microwave oven. There are basic tips about what to use, what to avoid, as well as QR codes to help you kind of shop for safer options. A third option here is just enhancing education, especially around private well users, regarding drinking water contaminants and treatment options in their wells. There are known contaminants of concern, like arsenic, like radium, like nitrates, that we have to do more to encourage those on well water to look for and to get out of their water. It's a huge risk factor for also, a number of different cancers. But there's support programs or other programs in other states that are doing this, right? So I'm showing kind of a toolkit that the state of New Hampshire developed through programs out of Dartmouth University, giving residents the tools they need, the resources they need to undertake these activities. It's the same, basically it's applying what we do for radon and trying to encourage homeowners in the indoor environment to test and to treat. Well, we need to apply that same logic and those same strategies for kind of these exposures that were being experienced in well waters. Some of the institutional, interventions, we can think, for example, of some of the workplaces that are most highly exposed. Firefighters are a huge source of exposure to a range of toxicants, including cancers, and we know that they're at much higher risk of occupational cancers than many occupational sectors. And there are studies out there that kind of tell us how to reduce exposure, strategies to reduce exposure among firefighters. And I'm showing kind of an article at the bottom. It's a number of strategies that can be undertaken within firehouses to reduce exposure to carcinogens and other toxicants. Information is there. It's just about implementing it. Another example is just supporting substitutions, to safer alternatives among industrial users of chemicals. There are a number of organizations that have deep knowledge about alternatives that work for our toxic chemicals in a number of different functions and applications. And tools to support and technical assistance opportunities to get out into industry and say, hey, I've got an alternative for you. You don't need to use hexavalent chromium to do this coating, plating operation. You could use trivalent coating, chromium instead, and it'll provide the same, end, and it's not carcinogenic. A number of halogenated solvents are known carcinogens. We have a range of different applications and alternatives that can be used without kind of those toxic profiles. So again, technical assistance directly to industry to encourage change. And the last intervention is really policy. This is, we have an opportunity to restrict carcinogenic chemicals in consumer and industrial products. It's a tightrope to walk. It's very political to undertake. But there are examples in a number of other states that have done this. Minnesota, California, Colorado, Maine, Vermont, you name it. States have done this. And we banned a number of different carcinogenic chemicals in a number of different consumer products, and Iowa can do it too. And I want to elevate an opportunity that I Googled and found there's a House bill currently being discussed that is about prohibiting the sale or distribution of upholstered furniture containing flame retardants that we know are endocrine disrupting agents and have links to cancer. And that prohibit the manufacture, sale, or distribution of food packaging, firefighting foam, and firefighting personal protective equipment that have these PFAS chemicals in it, right? So these are the ones that are stain resistant, water resistant, and are known to or have been studied, and we see links with testicular cancers, kidney cancers, and possibly breast cancer, and along with a laundry list of other diseases like an inability to fight infections because your immunizations don't work, or thyroid disease, or liver disease, or kidney disease. These particular chemicals are ones to get rid of. And so one thing to say about all these different layers of interventions is also just to say that that you can't just do one, right? It's the collection of all of them that matter. We made gains on lung cancer rate reductions because we employed a number of strategies to do it. It wasn't just one that did it. It wasn't just the quit line, right? That we can explain to the reduction in lung cancers. It was a full force action, that employed all the strategies that we can throw at it, that we saw the reductions that we see. So we have to keep that in mind. It's not one thing alone that's going to do it. We have to take it from a systems perspective and do what we can. So just some closing thoughts. Again, cancer is complex. It's a multifactorial disease. There are many things that cause it, but we don't know how it works ultimately, right? And so there's also many opportunities for prevention. I hope this talk revealed that we know a lot about causes of cancer based on environmental and occupational exposures. The question is, what are we going to do with that knowledge? How do we act on it to reduce, cancer risks going forward? There are, within all of those strategies that I mentioned in terms of intervention strategies of what we can do to stop these exposure, these are partnerships that you can leverage. You don't have to start from scratch. There's so much experience out there to leverage to move forward on what might be possible. And lastly, it's just kind of a recognition. Unfortunately, unlike trying to improve exercise or or even radon, these are politically uncharged factors. The environmental ones are charged. And so there are many financial interests that want to keep the status quo. But I have to say that change is possible. Many jurisdictions are doing it, and I'm here to help support Iowa going forward. So thank you.
Thank you so much, Molly. That was fabulous. I am gonna head straight to chat questions because folks have a lot of thoughts. So one thing that folks are interested in learning more about is the process by which a chemical is classified as a carcinogen, especially in comparing the US, which I would say has a lack of chemical policy, and other countries like in the EU. If you could talk a little bit about that and why there may be pushback or interference from industries in this process.
Yeah, well, there's so the IARC is an international body, right? So a lot of our policy uses of how something has been classified is based more on that versus, every jurisdiction having its own authoritative body. That said, the US does have something very similar that's out of what's called the National Toxicology Program out of the National Institute for Environmental Health Sciences. That does something similar and reviews the state of knowledge with regard to what we know, deep reviews of the literature, looking at mechanistic information, looking at toxicological information, and looking at epidemiologic information, and passing judgment as to the sufficiency of the evidence to declare it a human carcinogen. Under that rubric, it's either a known carcinogen or reasonably anticipated to be one. And we do have our own lists and we do have our own processes. I think it's not so much about classifying the evidence versus about using it. So the difference between the US and the United States is what they do with the information that they have, right? In the US, we have issued a lot of restrictions on carcinogenic compounds. In the EU, for example, they've issued a number of them. I can't even tell you how many, very few chemicals in cosmetic products or personal care products have been restricted under our FDA. In Europe, it's over 3,000 of them, right? So it's not so much how we classify or how we look at the problem. It's more how we look at the solution. Are we willing to act on the evidence that we have? In the United States, we aren't. That's the difference.
That's a great summary of it. Thank you.
Can I ask a quick question?
Yeah, go ahead.
The reason why we don't want to look at the solution, what is the pushback from the chemical industry in this process? And how can we as consumer address this?
It's a financial stake, right? They built an entire infrastructure and industry based on it. There's profits to be made on the products that they're currently manufacturing. And it's not until you tip the scales that make it financially uninteresting to them that you can make that change. And we see that, I think, with glyphosate, right, which is the pesticide that's used in Roundup. I heard that that the industry is going to stop putting it into kind of residential pesticide products because of the litigation that's happened, not because of the state of the evidence, but because it's in their financial interest to change because there's billions of dollars now tied up in lawsuits, right? So we call this, regulation through litigation. And it's, I just think it's the financial stake. And the same, I think, is unfolding with regard to these perfluorinated compounds, PFAS. Two of the major manufacturers of these compounds agreed to no longer manufacture them, 3M and I'm forgetting the other one, DuPont, I believe. And in part because of the lawsuits. And also just because of the mounting evidence and regulatory paradigms, such as those that are in the EU that are going to restrict all of them. So it's, sometimes I think they're more willing to act because restrictions or regulations are a lot stronger in other jurisdictions and they follow that, right? They're not going to necessarily manufacture products just for the United States. They're going to manufacture it for their global market. And so what goes down in Europe does matter here, and we all benefit from it. But ultimately, I think the reason is the financial end. There's too much money to be made by keeping the status quo.
Thanks, Molly. I'm gonna launch the post-session poll just as a warning. So that'll be up while we're answering the last one or two.
And I meant to stop about 5 minutes ago, you all. So I'm so sorry that I'm not able to have more of a conversation with your questions.
This was so helpful though, and this is recorded so folks can go back and watch it. And if you have any questions or insights, feel free to reach out to me. And I can get them to Molly and we can.
Yeah, and I also apologize. I didn't put my contact information on a slide, but please, yes, reach out to Caroline and I'm happy to engage with you all going forward on this topic.
Thank you. I believe we have time for one more question and no one's putting no knowledge. So thank you all. That means we all have a takeaway from this presentation. So I did want to address, just because it is important in Iowa and the Midwest, like Audrey said, when it comes to nitrates, what are the dangers associated with them? And if you're not in a major metropolitan area with a water plant, how do you reduce this type of exposure? And someone else had a well water versus tap question. So if we could just revisit that.
Well, I think this might be the topic for a future webinar, because there's a lot of water treatment technologists and experts out there that will know more than I do about kind of the treatment technologies that are available to do nitrates. I think reverse osmosis is one of them. And, I think you have to honor the fact that a lot of the people will advise whether or not you need to use a whole house system or a point of use system, like just putting it on your tap because you're going to drink it versus like putting it on your at the entry to your house because, being exposed through showers or bath, taking baths also will really matter. There's a handful of cancers that have been associated with exposure to nitrates. Bladder cancer is one of them. I think stomach cancers might be another. A lot of it, what we're seeing is the links with ingestion. And there's a range of other kind of health effects, not just cancers that are related to nitrate exposures, but let's dig into this and get other people to help to figure out what the solutions are. But you have to test a well in order to know whether or not you've got high levels that warrant remediation. And the state, I'm sure, we can share out resources of all, all the testing labs that are available to do this.
Yeah, like Nitrate Watch. Thank you, Heather. So we'll have a list of resources for folks to be sent out as well as the recording. I just wanted to thank you all so much again for joining. Thank you, Molly. This was really such a great presentation and a really great start to a much longer discussion and hopefully some action as we figure out the direction of the task force. So really appreciate you. And thank you all for joining. And we hope to see you all next week when we hear from Mary about cancer in Iowa.
Wonderful.
So, thank you
everyone.